Hello, my name is Noble Foley, and today I would like to talk to you about schizophrenia. I picked schizophrenia because I think it's really important to me, at least, because my dad suffers from it. It's not like a severe case, but he definitely does suffer from it, so I thought it would be interesting to me, and hopefully interesting to you. Uh, so yeah, for our definitions, we have disorders. Um, Schizophrenia is a disorder. So, usually disorders are defined as a functional abnormality or disturbance, and they are categorized into different subsets as well, like mental disorders, physical disorders, genetic disorders, etc. And schizophrenia is a chronic brain disorder, and it only affects less than 1% of the US population. And schizophrenia itself is also categorized into different types of schizophrenia. And they all have their own different types of symptoms. But but what we're talking about today is just the overall scope of schizophrenia. So the different types, for example, would be paranoid schizophrenia, catatonic schizophrenia, disorganized, or hebephrenic schizophrenia, and there's a whole bunch of different types as well, but we'll be moving past that. So for the symptoms of schizophrenia, we have hallucinations. So you would hear stuff or see stuff as well. And you would have a heightened sense of paranoia and perception. So like you would see or hear something, and then that would freak you out more, and then you would see a whole bunch of weird stuff. It's pretty terrifying actually. Uh, and you would also have a lot of trouble trying to, do cognitive tasks like speak and express emotions, initiate some kind of thinking at all. Well, not at all, but like complex thinking. So, overall, you are going to be confused and you're going to have disordered thinking and speech. Schizophrenia is usually developed with some problems during brain development. However, it's kind of up in the air since some researchers and doctors think that it's a genial issue, where some people think it's only caused by certain actions that you do as a teenager or as an infant. So it's kind of up to interpretation on what you want to believe right now. Um, Hopefully, it's not a genial issue, so people have like a chance to not just be born with it, because that would suck, obviously. But you could be caused to, or you could be prone to getting it if you do things like LSD or marijuana as a teenager. So when you have schizophrenia, you have a heightened increase in dopamine, which allows you to see hallucinations and delusions. The usual treatment for schizophrenia is antipsychotics. These, of course, come with a lot of side effects as well, like nausea, vomiting, waking, diarrhea, and sleepiness. Uh, the common factor between patients is that they're usually elderly, so that means that they have schizophrenia in their early life, but not in their like younger years. It can happen, but it's more rare. So overall, schizophrenia causes hallucinations, and paranoia with distorted perceptions, beliefs, and behaviors. The treatments for schizophrenia can be antipsychotics, but however, this does come with some side effects of nausea, vomiting, weight gain, diarrhea, and sleepiness. And the cause of it seems to be that it is a abnormality that develops when you are having your brain grow and develop as a person. So if you were to have, LSD or marijuana during as like a teenager when your brain is still developing, you could be prone to getting schizophrenia as well as getting like a virus as a little child or a baby. So overall, that is what schizophrenia is, and that is the symptoms and treatments for it.